I grew up in Henry County, one of the first hospitals here. No one thought I would make it. I was a premature child and went home in a shoebox, was what my mother said. Our little community has had 5 different communities: Buchanan, Springville, Henry, Cottage Grove, and Puryear. They're all circling Paris as downtown as the county seat. Henry County has always been my home, and I love it, and I think everyone should. You see Henry County pulling together, and that's one of the serendipities, I think, of having our little community, is the people that you meet and the friendships that you make.
Now the defense has got to really hold up here, shore things.
I started out doing play-by-play football 40 years ago.
Craig was there to make the catch.
It's a passion. Once you get into it, you really enjoy it. I enjoy broadcasting the games because you become the voice of the team.
The thing is, one of the receivers looked back like he was going.
So Friday nights is a big night for Henry County. Little things like that makes it enjoyable. In December, 1 year exactly, I go to the doctor because I'm having some issues and I'm diagnosed with having prostate cancer.
Unfortunately, Mr. Jackson presented with an aggressive prostate cancer, certainly more aggressive than we would typically find.
I had my surgery here in Paris, and Dr. Joe Mobley did a fantastic job. It was close to Christmas. I don't know very many doctors that would tell you, here's my cell phone. I'm gonna be out of town, but if you need me for something, you don't hesitate to call.
David, like a lot of people, has had important medical problems that many times people would think they need to go elsewhere for. You know, across the nation, rural hospitals are closing right and left.
We have to find a way to pay our providers to provide these services. We have to find ways to recruit these people to stay in our communities. The physicians, the nurses, those are the 2 areas where we have such shortages.
Programs such as TCWD and the THA's program of attracting physicians to a rural setting is the only thing that's going to keep places like this open and viable.
Coming back and being in the community and being able to see and treat patients that have that sort of connection is pretty special and pretty unique. David is a great guy. It's special in that David's son, Travis, and I grew up and went to high school together, graduated together. We were in plays and sports and all of the things that you do. So, but yeah, David is doing wonderfully. He's such a blessing to the community, and it's just been a special thing to be able to help take care of him.
Have a good one.
So THA and TCWD help find a way, find some idea to solve an issue. We could have been in jeopardy of losing pediatrics if we didn't have that funding.
People think that in a rural area they can't get good care, but once that bond of trust is built, people will come. I first met Dimitri on the day he was born, and I have been his pediatrician since that time.
He was having some symptoms that didn't make a lot of sense to me, like he would tell me that his legs hurt really bad. He was tired all the time. They would call me from school saying that he had his head laid down on the desk and he was tired and he didn't feel like doing his schoolwork, which is not common for him. I took him to a pediatrician in Hattiesburg because we lived in Hattiesburg, Mississippi at the time. He diagnosed him with sinusitis, put him on an antibiotic. He just looked really sick. He looked like he needed to go back to the doctor, but I didn't want to take him where he had already been.
6 months after they moved, Mom called me and said, I'm going to come see you.
But Dr. Selby knew almost immediately.
When Dimitri walked in, he was not the Dimitri I had seen. He had lost weight. He was very pale and downcast. He was very weak. So we did a CBC. He was severely anemic, very low white count, and his platelets were very low too. all of those kind of pointed towards leukemia as a diagnosis.
When Dr. Selby had to come in the room to tell me that she thought that Dimitri had leukemia, she was pretty upset.
I told her, I said, Patricia, I'd rather tell you anything than what I am about to tell you.
I could tell by the look on her face. We become friends over the years.
She was in shock, but she was very accepting that, yes, I can trust this diagnosis, and yes, we need to get him to St. Jude's as soon as possible.
You feel lucky whenever you know that you have doctors around that you can trust and that you feel confident that no matter what's going on with your kids, they're gonna figure it out. I mean, I drove 6 hours at 4 o'clock in the morning and she figured it out.
Dimitri has had a fairly good course. He's had a few episodes of being admitted for fever and low white blood counts, but overall he's done very well with his therapy, and he is blossoming again.
That pediatrician would not have been here had it not been for those resources from THA and TCWD. So THA and TCWD were just great at bringing the resources to us to support service lines that were very vital to our community. So when we can reach out to a place that offers recruiting services for retention and sign-on bonuses, that certainly puts an additive amount on the table for these physicians to be here. And we have so much to offer.
It's a great community to live in. We have all kinds of activities that are going on for the kids.
You can use your body, okay? Here you go, we'll put that one in your bag too.
This was some place that we felt like we could raise a family and be for the rest of our lives. And that's turned out to be true.
It's one thing for a doctor to be a doctor, but when they're a friend, I think that's what makes our doctors stand out here. It's great to have the quality of care that we have, and I just hope it will continue.
If we were not present and if Henry County Medical Center wasn't here to give us the support that we need with labs and x-rays, people would have to travel to get their medical care. That's a service we provide to the community. That's a vital service that means life or death to that patient.
I feel very lucky to have them near us. I see a big future for that little boy.
People come from all over the country just to settle in Paris and Henry County. That aspect of health care that's provided is something that everyone looks at, and Henry County's got it. What's your favorite ice cream?
Vanilla.
You know that little girl up there? You know what her favorite is? Cookies and cream.
To reach out and find those resources like THA and TCWD is so helpful to bring that in so that we can grow and be vibrant right along with our community.